Texas Children's is really committed to the health of children, and I think probably the most critical piece of that is that we are really focused on the patient. We do know from emerging data that sepsis is the largest cause of pediatric mortality worldwide.
Pediatric sepsis is a condition that is very serious in the fact that oftentimes we're looking at a patient, we suspect that they have an infection, but we don't know yet.
Getting a handle on how many children we had, where they received care, was incredibly important and required a great partnership with our clinicians and our IS department with an architect who could translate those requests and needs into actionable data.
As an organization that had entered into a heavy analytics journey about a decade ago, we had really hoped to take our learning from moving from bedside data reporting into data analytics.
Data is where you can understand the problem. Data is where you can monitor the problem, and data is where you can improve things. And you always have to have your finger at the pulse of the data, because you can guess and try to understand what is going on, but until you know the data, until you know the numbers, you don't really know what's working and you don't really know where to go.
We have used data and analytics every step along the way. It's really about helping the clinician to work smarter, not to work harder.
After bringing the data together and using analytics, we've been able to understand which of our patients are at risk for sepsis, which of our patients have sepsis, and how to improve their care.
At Texas Children's, everything we do is with the patient at the center. And so if we always keep our eye and focus on the goal of taking care of patients and taking care of their families, then everything else falls into place.
Texas Children's has seen some tremendous successes. We had a 36% reduction in our 3-day mortality. We saw a 45% relative reduction in our 30-day mortality rates. We saw over a 25% improvement in timeliness to antibiotics. But what's really important is the lives that we saved. That has been our greatest success.